My name is Dana Arnone. Believe it or not, I once dreamed of a career in fashion journalism, but life had other plans. I became a registered nurse and eventually the owner of a home health care agency in Long Island, New York. Now, I'll be honest, some days are hectic and sometimes I just want to scream, but my mission and my passion is what keeps me going, helping seniors navigate the chaos of aging in today's world. Every day I see the challenges our seniors face, and it drives me to fight for change, because no one deserves to face the end of life alone. After all, sooner or later, we will all be seniors. So come join me on this journey where we tackle the tough questions, uncover the truth, and fight for the dignity, fairness, and justice for our aging community. Welcome to Senior Care Matters. Welcome back to Senior Care Matters. I'm your host, Dana Arnone, and today we're with Senator Rivera for part two.
Again,
we're back again. So we wanted to continue. The conversation is so important that we just want to continue having it. So we were talking before about barriers of home care, or providing home care or receiving home care. You know, one of the things we were discussing is staffing. So one of the other things that comes up as a barrier, it's a huge barrier, especially in Long Island and probably upstate New York, is transportation.
Certainly in rural parts of the state, I don't doubt it, yeah. So
you have, what ends up happening is you have workers that make $20 an hour, $21 an hour. Affording a car insurance and all the things that come with a vehicle is almost nearly impossible for them. So they rely on public transportation. So Long Island is very difficult, and even in the Queens. So transportation as a whole, is there ever a conversation that the government has some type of reimbursement for the workers or helping them get to and from these jobs? Because, you know, I always think about when you're young and you're looking to buy a house, you're getting married, you don't think about you're going to be 85 years old needing home care one day. So you're not thinking of the fact that when you're buying a house in Oyster Bay or Bayville that you're never going to see an aid.
Well, this is definitely an issue that has come up before, and certainly when it comes to parts of the state, you sometimes forget that the state is as large as it is, and there's parts of the state. If you think there's transit deserts in an urban setting like the city of New York, or even a suburban setting like Long Island, you get to upstate New York, to some of the rural parts of the state, and certainly the fact that people have to commute to the person that they're going to take care of is an added cost to them. If you think about the fact that some of these individuals, if they don't have access to health to home care, might get bad enough that they have to go to a nursing home setting, that's only going to cost us so much more, right? And on top of that, there might be the situation that led them to get to a nursing home means that their condition has worsened, which would actually, in many instances, you would have been able to stabilize it if just provided regular home care to these folks.
You know, just
something as basic as that. Certainly, something as basic as that, which would be available to them if they had an aide that was then at home and saying like, "Hey, have a drink of water today." Like, individuals that have to travel long distances to take care of people have added costs that, as you said, added transportation costs if they can't use public transportation, if there's no public transportation available to them. Having them be paid better and having that be considered into what the rates are that are given to home care agencies, that I think that has to be part of the conversation, because that's just a reality. The aid that is traveling to the person's home is going to need to get there somehow, and we need to figure out how to.
Or they're not going to go.
Or they're exactly.
That's really what happens.
They're not going to go.
If
they don't have, and that means then that person doesn't get taken care of, and then we see the spiral that happens there, and then that person might wind up in an emergency room or a nursing home. So it needs to be part of the conversation. There has to be a strategic long-term plan that needs to be led by the executive.
We talk about transportation all the time, and people usually would say, well, no one worries about me. How do I get to work every day? No one worries, because they don't understand. In home care, that worker, that home health aide, that personal care aide, they are sometimes traveling an hour on a bus, taking 2 buses. Who would, say that I would rather be out of my home for 10 hours a day, compensated financially for 6 hours a day, but I love my job, so I'm going to continue to do that? No, they're going to go work it elsewhere. They're going to go to Target. They're going to go to, wherever.
And the thing that we talk about a lot, like if you don't drive and if you never thought of or how you're going to get to work, usually what you're going to do is you're going to go to work at the closest place to where you live, right? One bus stop away. Maybe I can walk. Maybe I can ride my bike to the job. So they're being smart where they're getting employment. In home care, these aides don't know where they're going. Every day, if their patient is switched or a patient passes away and they need, this is a whole other issue about not getting compensated for a full work week. But when you're looking at them and they're lost, if they're patients in the hospital and they're available to work, where they used to take one bus to go to Seaford. Now we're telling them, no, the patient that you're going to go see is in Glen Cove, which is a whole different area and a whole different, they can't even take the buses there. So it does prevent people from taking the employment, taking the opportunities. You know, we did a study one time in my office. If we transported all these workers, what did our missed visit rate look like? What did our retention rate look like? And also, what the overall ratio of how many employees you're working at any day. We used to do 30% of missed visits, meaning 30% of patients are not getting care because we can't get a worker to go. Once we started helping with transportation, it's down to about 3. We have we're using the workforce regularly because there's no barrier of saying no. We get them there, we help them, we put them on the trains, we pay for MTA, all this other stuff.
And by the way, thank you for doing that, but it should not be your responsibility.
It is.
It's like it is part. I mean, this is it's the part of, I mean, you considered it a part of doing business, I guess, but it.
No, I don't consider that. I think it's a problem.
No, it's absolutely a problem because I'm saying that you probably roll your eyes while you say like, I guess it's part of the deal, but it shouldn't be. It shouldn't be, and it's like, because again, you're providing a service that's essential. I sincerely believe that people getting access to home care means that they stay in their homes, that they stay healthier for longer, that they live longer, better lives. And again, it just costs us so much less than it does, even if we raise rates as I believe that we should, and we pay people better as I believe that we should, it still saves us a lot more money than getting somebody in an emergency room or a nursing home. And that's the thing that we have to think about. How do we invest it now to avert the costs that not investing now will cause us? Like I just have to think about that.
Yeah, good. Think about transportation. It's a
problem.
Think about transportation. Okay, so another thing that we want to talk about is agencies. So, you know, as a home care agency, you know, everybody's afraid of Medicaid cuts, funding not going, you know, coming to the agency, going elsewhere. So is there any type of regulations or policy to help oversee what's happening for the agency so they can continue to provide the care? You know, the regulations that go on in a licensed agency between the Department of Health, just in all the regulatory standards, which is very important, but it does cause financial stress on agencies, not only that, workers' comp, all this other stuff. So in order to keep agencies vibrant and providing those cares, is there any type of funding that the agencies are going to be looking forward to, or they're not going to get the Medicaid cuts that everybody's waiting for, thinking about? You know, are there ways? And there's one more thing. If you end up keeping managed long-term care, which I don't think you're going to, but if you do, there should be some type of oversight of the rates that they pay their vendors, so agencies, because right now it's like a free-for-all. If the one managed care does, you know, a lot of business with one agency, they pay a higher rate. The other agency that maybe doesn't do as much business with them is paid differently. There should be some type of standardized pay rate for agencies so that they can remain sustainable and employing people, keeping them employed, which is also very important. You know, not only just keeping people out of the hospital, but employing people and providing that care. So is there any type of assistance or regulatory help for agencies so that we can continue providing these patients the care?
Well, there's a lot there.
I know.
I would say
Part 3.
Yes, I say the place we start by saying that one of the things that we try to do in my office, again, as the chair of the health committee in the Senate, it's part of my responsibility to kind of do oversight of the agencies that are responsible for, like the governmental agencies that are responsible for implementing the laws that we put into place, and to make sure that they're doing the right thing. And so one of the things that we do is we work with stakeholders like home care agencies, nursing homes, hospitals, doctors, nurses, et cetera, and home care workers as well. They always have the access to my team in my office so that we can better understand the type of issues that you deal with on a day-to-day basis are things that probably you know far better than me because you do it on a daily basis. The issues that a home care worker has, and as we talked about earlier, transporting themselves to the home of the person that they're going to take care of, or they feel that there's a lack of training that they need to have to be able to better perform their job. All these things are things that are better understood by the individuals that are being struck by the issues. And so my office has an open door policy where we try to better understand how these issues impact folks on a day-to-day basis, and then try to come up with the best solutions possible. So as it relates to, and during the budget process every year, we try to certainly hold the line when we can, push for more resources when we need to, and do it from the perspective of how it's best going to help the individuals that are going to be impacted by these decisions that we're making up here. Now you talked about some of the Medicaid cuts, and that relates to federal action.
Mm-hmm.
Like the reality is that we have a federal government that is trying to they're trying to do a lot, but as it relates to healthcare around the country, and Medicaid in particular, let's just stick to that. It's something that because think about it is Medicaid is a health insurance plan for poor and working class folks, so the most vulnerable around the country, and this is even when you have the working poor, because there's a whole bunch of folks who are employed that just don't make enough, or they don't have the right job, so they don't have access to any type of insurance, so they have to get Medicaid. And the cuts that are going to happen from the federal government are going to be incredibly severe, and they're going to impact the absolute most vulnerable among us. And that is only going to impact the rest of the system, because it means that they're not going to be able to have access. They're going to rely more on emergency rooms. People who might not get access to home care are now going to go into nursing homes. So all of this is going to cost us far more money at the state level, and it's just going to hurt the most vulnerable. So we're kind of in a crisis mode. I call it fire alarm fire, mm-hmm. and I certainly the next budget cycle. We're recording this on November of 2025. The budget for 2026 in the state of New York is going to be a doozy, and I certainly believe that there are some things that we can do to hold off some of the worst things that the feds are doing. But part of the conversations is how better to support agencies that provide home care, because, again, I believe it is an essential part of keeping people healthy.
Yeah. We're going to take a short break. We'll be right back with Senior Care Matters.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825. Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need them most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org. We all say, today is the day that we tackle the organization of our homes. The day gets further and further away, but the job never gets smaller. We can take the headache out of planning and doing. We start with a free consultation, create an action plan, and bring you the space and peace of mind you need. We help with home decluttering and organization. Restore your home to a place of comfort. Call today, 516-322-2613. At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Welcome back to Senior Care Matters. I'm here today talking with Senator Rivera about both of our favorite subjects, home care. So continuing the conversation, we were starting to talk about CDPAP. So what's the state of CDPAP right now in the state of New York? CDPAP, Consumer Direct.
Yes, for folks who might not know what this is, CDPAP is Consumer Directed Personal Assistance Program. It was something that started in New York State. And it's the notion that if you are a person who is disabled, physically disabled, elderly, but still can communicate, you might want to choose the personal assistant that takes care of you, and that person potentially could be even a family member. But it is a program that, unfortunately, the way that it was originally structured, well, first of all, if you are taking care of me, if you're my aunt or something and you're taking care of me, you might not know HR, you might not know how to fill out paperwork, etc., which is why we need a third party, which is a fiscal intermediary or an FI. So unfortunately, the way that it was originally structured around the state, FIs proliferated in a way that was just crazy. And at one point, over 600 fiscal intermediaries existed around the state of New York.
I lost my contract.
So we're going to get to that. Now, over 600. It is true that was too many. But it is also true that the solution that was proposed and ultimately pushed down the throat of the legislature by the governor was the wrong one. The solution, and I put this in quotation marks, that the governor proposed and ultimately got in the budget last year was to go from 600 fiscal intermediaries to 1. And doing that in a program that is by far the largest in the country, so by hundreds of thousands of workers, hundreds of thousands of patients or consumers. So we're talking about ultimately millions of people who then had to switch from hundreds of fiscal intermediaries to 1 and do it in a shorter period of time than any other state had done it around the country. I spoke on the floor of the Senate when this was being, again, pushed down our throats. I was asked by my Republican colleagues, this whole CDPAP thing, why is it in the budget? And I said, I don't want it in there, but it's the best that we could get done. It's the best that we could get done. The governor insisted that she wanted this solution, and we got a slightly better one. I'm going to keep my eye on it, but I don't think it should be here. I still will vote for the budget because there's all these other things that I do believe in and I think we should do. This one was one that I did not want in the budget, but there it is. And so fast forward, in January 1st of this year, the transition process started. And as soon as it did, everything that we thought was going to happen happened. People were not able to get anybody on the phone. They weren't able to go to an office to actually make the transition happen. If they were able to get somebody on the phone, perhaps they weren't able to get somebody who spoke their language. They were able to get somebody on the phone, then said they would be called back, and they weren't called back for weeks on end. One thing after another, after another, after another, and in real time, the patients, the consumers, and workers were telling us how bad it was, and we were communicating that to the executive, and the governor ignored it. And so, this is the short version, believe it or not. Where we are right now, unfortunately, is that this was a failed process. This was a failed transition. The state Senate did a public hearing just a few months ago to really try to get to the bottom of things, and we're still nowhere near the bottom of it.
Is there a chance for it to go back to the agencies that lost their contracts, or is it like a done?
There's a bill that I introduced that would actually change the system. I do believe there were bad actors in the system. That is, there's no disagreement there. But I do think that it was an overcorrection. It certainly shouldn't be 600, but I always thought that 1 was an overcorrection. And unfortunately, that company has also been horrendous at their job. And they have not been, and also they were not responsive to us in any real way. We had the Senate Democratic Conference. So the Senate majority held a special hearing that was co-chaired by me and by my colleague James Skoufis, who is the chair of the Investigations and oversight subcommittee in the Senate. So I'm the chair of health, he's the chair of investigations. And we did a joint hearing, many of our colleagues came, and we asked them direct questions, both the Department of Health as well as PPL, which is the company that is responsible for it. And the answers were ridiculous. The answers were ridiculous. These folks on the record telling us, oh, we didn't know this. Oh, but people couldn't get anybody on the phone. Well, that's the first I hear of it. There were people gasped in the room. And I said, and I just looked at this person, I said, with all due respect, sir, that is literally impossible. Because my office was telling you in real time, privately and publicly, how bad you were messing this up.
So what do you want people to take away from this conversation for a CDPAP? Like, what is your goal? Well, I know what your goal is, but so what is it that you want people to understand?
As far as CDPAP, what I want people to understand is that there's some of us who will not let this go. There's some of us in the legislature who believe deeply that this program, which is, again, a program which is about taking care of the most vulnerable and giving them the opportunity to lead full lives, was basically taken away from them, in a sense, because of the failed transition to the single FI.
So the last thing, Senator, I just want to take a couple minutes to talk about is the NHTD waiver program. So the Nursing Home Transition Waiver Program has been really a vital role in helping keeping people home, because it gives them the amount of hours that managed care doesn't give. So a lot of times we'll find a patient who is not getting the hours, maybe 3-4 hours on the managed long-term care, because they have dementia or a cognitive issue. They're not going to give them any more than those hours. So we refer them over to the NHTD. There's a cap going on that's going to be initiated in, I think it was supposed to be like around now, for capping out on the enrollment for NHTD waiver participants. So that's going to create a big problem, because they're not going to get the care through managed long-term care, and now they don't have that program to refer to. So is there any way of saving NHTD or providing that care, or maybe creating another program for people that may not qualify for the hours through managed care, but now they can't get into the waiver program?
The answer is yes, potentially. First, I'll say that, again, this was a decision that was made during the budget process, and one in which we as a Democratic majority resisted and tried to push back on. But the outsized power of the governor during the budget process in the state of New York makes it so that we try to negotiate, we try to get the best deal that we can, but ultimately the governor can say take it or leave it, and ultimately we had to take it. But we can certainly revisit it next year in the budget process, which will start just in January, so just a month and a half from now, I guess. And I think that certainly it should be revisited, because we cannot continue to chip away at all the different ways in which the most vulnerable people in our state get taken care of. Mm-hmm. If we continue to do that, it's not only going to make their lives shorter and less healthy, it's going to cost the state a hell of a lot more money. We have to be better at this. We have to be realistic about what the long-term issues are here, and then because they're long-term issues, they require long-term solutions. They require strategic planning, and there needs to be a sit down to say, let's bring all the executive, the Assembly and the Senate. Let's actually all stick together, bring the stakeholders in, and then have a plan about how we solve this in the long term. If we don't do that, we're gonna continue to have conversations like this, and you're gonna continue to have issues that ultimately limit your ability to serve the most vulnerable in the state. I don't want that to be the case for you or for anybody else in the state. So it's about the strategic planning, and hopefully we'll be able to get there.
You know what I would ask, though? I would ask them, the people that say no or it's not important enough, I would ask them, what if it was their mother? What would they want for her or him or your dad?
Yep.
When we talk about care in the home, most of the time, and I'll end on this because it absolutely bothers me that people don't respect sometimes the home care worker, and yet the home care worker most of the time is the person that's there when that patient passes away. So I can't tell you the calls that we get to say thank you to that worker, because that worker was sitting there with their mother as she passed, or her father. So when people say they don't want to help, or people say, I'm not going to cry, when people say that they really don't acknowledge or see home care, I would ask them, what if it was them?
Yeah.
And that's the way I would end it. That's terrible.
No, it's not. It's like this is obviously something that's very real to you.
Well, you know what it is.
How long have you been doing it? 30 years?
I've been a nurse 30 years. I've owned the agency for about 10. But when you're hearing that family on the other side begging for help,
yeah,
literally begging for help, that they have to go to work, they can't stay home. So their choice is, I make a living and feed my family and somehow pray my mother's okay. It's not a choice that we should have to make.
Oh, you agree?
And it's a choice that they're making every single day.
Yes, ma'am.
I'll tell you one more thing before we so we had a patient that was on service with us for a while. She had dementia. She lived alone. The daughter lived up the block. The daughter worked and had a camera on her mother all the time. So the mother was home, fully demented. I mean, it was a bad situation. You know, couldn't care for the pets, couldn't care, whatever. I called Adult Protective Services on ourselves. So I said, this person needs help. Can you please, and go evaluate her? So they went in. They said nothing was wrong. The patient was fine. They left. It was in the middle of winter, and the patient's daughter was having a birthday party. So she was watching her from her house down the block on the camera. But she went to continue with her party, and the patient wandered out of the door in the middle of January, fell on the stoop, and died. So now my home care worker, that $20 an hour worker, comes to the house. She's cared for this patient for a very long time and finds her patient passed away on the stoop. She only got 5 hours of managed long-term care, 5 hours of Medicaid assistance, and she ended up passing away on the stoop, and that worker found her. I have so many stories like that. It really would break your heart. So it's like we have to do better.
Yes,
we know better, and we really do need, as a culture, need to do better.
I agree with you fully. This is the situations that we have right now, where probably hundreds of thousands of New Yorkers, and not only New Yorkers but around the country certainly, our people are in their most vulnerable states, and they have someone who is an essential piece of their family that actually makes sure that person is healthy or is safe, is taken care of, as you said, drinks the water that they have to drink or eats the food that they have to eat or get the medicine that they have to take. We need to be better about how we support the system that actually makes sure that those people are healthy and well. And we need to do a better job around the country, certainly, but I believe in the state of New York that if there's one thing that I say consistently about the state of New York, because I do believe that we are a great state. And I believe that we not only have an opportunity, but an obligation to do better on all these things. And certainly it's what drives my work in public service and around this issue. I hope that we'll continue to work together to actually make it better in the years to come.
I hope so too. Thank you for watching Senior Care Matters. I'm your host, Dana Arnone.